when our patient comes in and we see a patient on our day sheet that is having a toothache, what we're doing before the dentist comes in, we're basically collecting data, right? Just like we did with our health histories, we're going to be questioning our patient and we're going to be collecting data to present that to our doctor, okay? So, did you do that this morning with a little bit with the questioning?
Yeah.
So part of the questioning is, so I understand that you've been having a toothache. Can you tell me where it is?
It hurts on my right side.
On your right side, top or bottom?
I don't know.
You don't know. Okay, so right now she's kind of giving me a varied response, top or bottom. Now what elicits the pain? Hot or cold? Biting?
Mostly with cold, sometimes a little bit with biting.
With biting. And how long does the pain last?
It hangs out.
For how long? Minutes or seconds?
Not quite a minute, but longer than seconds.
Okay. And do you find it is irritated more with cold or hot?
Cold right
Cold.
now.
Okay. So here she's told us she's not sure whether it's top or bottom. Cold irritates it the most, and biting, and so you said that there was some sensitivity with biting. Biting soft things, hard things, things with little seeds. Can you be more specific?
Softer.
Softer foods.
Yeah.
Okay. So really, your teeth will always have a sensation. Your teeth will always give you a feedback response. You should be able to chew soft foods without any irritation. So right now she has an area that's causing her cold sensitivity and biting sensitivity. So right now I'm going to do a few tests that's going to help specify what tooth it is, all right? And these are the things that you're going to do before your doctor comes in, and with the information that you're going to gather, you're going to present your doctor with it, okay? Okay, so I'm just going to put you back here and I'm just going to do a few tests, all right?
Okay.
So you did say that the area was on the right side. So first of all, what I'm going to do is I'm going to take a quick look. And I'm just going to look for something really obvious. If there's any cracked teeth, any missing fillings, I'm going to see if there's any irritated gum tissue, possibly a fistula, and I don't see anything. So what I'm going to do first, I'm just going to do what we call a palpation, all right? So I'm going to run my finger, I'm just going to get you close a little bit, and I'm just going to run my finger right along here. And do you feel anything there? A little bit, okay? And like kind of right in there, okay? And then I'm going to come to the top. Do you feel anything in there? Okay, so she's not feeling anything on the top, but she's feeling something on the bottom. So right now we're getting some active response, okay? And I will go over to the left side just for comparison, okay? Do you feel anything there? No. Okay, so right now I've kind of zeroed it down to the lower right.
When you
Okay?
say palpation, you're like kind of pressing against like the retromolar palate.
What I'm doing is I'm going into the vestibule,
Okay.
and I'm just going right along the bone in here.
Okay.
Okay? Sometimes I can come along the lingual too, but what I'm going to do is I'm going to just sort of do an initial assessment, and then I'm just going to try to narrow down some of the symptoms that she could be experiencing, okay? So what I'm going to do is I'm going to do some percussion, all right? I'm going to tap on a few teeth. I want to warn my patients when I do this. If the area has been biting sensitive for some time, I don't want to be hitting a tooth that is ultra sensitive because it is going to be very uncomfortable for them, okay? So I'm going to warn them, all right? So I'm going to start up on the top. This is sort of our non-suspect area. We've now come down onto the bottom. So I'm just going to tap on a couple teeth here. I'm going to use the back of my mirror. The metal handle is going to be a nice percussion instrument. Okay, so this is number 1, number 2, number 3. Anything there? No. Okay, so now I'm going to come down. I'm going to come down to the bottom. Okay, so I'm going to tap a couple teeth here. So same thing. I'm also giving her choices, 1, 2, and 3. I don't want to be tapping a few teeth and go which one that it hurts. I want something very specific, okay? So 1, 2, 3, or 4.
Between 2 and 3.
Between 2 and 3. Okay, so, and now I'm gonna go backwards again. 1, 2, 3.
2.
Number 2. Okay, so the number 2 that she's specifying is the 4, 5. Okay, so that confirms when I was doing my palpation, things were feeling a little tender here. They could be feeling a little bit, are they under tender in there?
Mm-mm.
No? Okay, so we've got tender to palpation on the buccal of the 4-5, and the 4-5 is tender to percussion, all right? So my control teeth now can be on the maxillary, and everything had a negative response on the maxillary, okay? So now I can zero in on that lower right area, all right? So we have something here called endo ice, and so a few of you are familiar with this, and there's a question? Yes, so we will be coming around and we will be giving you
We'll dispense it for us.
yeah, we will dispense it for you. So what I'm going to do is I'm going to have a cotton tip applicator, and I'm just going to put a little bit of it on there. I'm going to dry off the area. I said, okay, I'm going to put some cold on your teeth. Okay, so I'm going to start with the 4-3. Do you feel that?
Mhm.
Yeah. Okay, and did that go away?
Mhm.
Okay, now I'm going to do the 4-5.
It's on the occlusal.
I'm coming along the buccal.
Mhm.
Okay, so that was a little bit of a delayed response. Okay,
So it means she's not feeling it.
she's not feeling it right away. Okay, so now what I'm going to do, I need to respray that. Okay, now is that sensation gone or is it lingering? It's lingering a little bit. Okay, so now I want to test the 4-6. How you do? Oh, yes?
Mhm.
Okay, so one thing I want to warn you with the endo ice, okay, and you can close. Okay, how's that feeling now? Like, is all the pain gone, or is there any lingering sensation?
No, lingered on the one.
Lingered, okay, so the cold sensation was lingering on the 4-5. She's actually missing her 4-4, so I went from the 4-3 to the 4-5. One thing you want to be careful about with the endo ice, don't place it on a metal restoration, okay? Because metal will transmit cold. So if there's a gold crown, if there's a metal filling, like an amalgam filling, avoid those areas. If there's recession, right? So if she had recession in those areas, I would stay away from that recession because that will be it'll be more of a intense response, okay? So right now, the 4-5 seems to be a bit suspect, okay? All right, so what I'm going to do, I have what we call an electric pulp tester here, all right? So this little device is called an EPT, an electric pulp tester. So what this is going to do, it is going to send out a little bit of an electrical current onto the tooth, and it's going to activate that nerve, all right? So when this gets put on the tooth, you're just going to feel like a little twinge, a little tingle. Once again, you do not want to be putting this on a metal restoration, okay? So in order to get this going, I'm going to put the little lip clip here, and that's going to be like our ground, and I'm going to turn it on, okay? And what I'm going to do, I'm just going to put a little bit of toothpaste on it, and the toothpaste is going to be our conductor. You don't need a ton.
I just want to show the normal range.
Yes. So, and I'm just going to start on an incisor here, okay? So the incisor is going to read actually fairly low just because it's got thin enamel, and I'm just going to go on the buccal, and I need more of this. Okay, so I'm just going to dry it off a little bit. I'm going to start on the 4-1. Or the 4-2, 4-1, there we go. So I'm going to go up, 1, 2, the little gauge is going up. Yep, okay, so as soon as she felt something, she put her hand up. So what did that feel like?
Just started to tingle.
Yeah, it's just like a little tingle. So don't be afraid, you're not going to be getting like a massive shock or anything, it's just a little tingle. So that was at a number 4, all right? And now, you okay there?
I was just gonna say, the readings on these new ones,
Are
they're
not-
lower than
Yeah,
our old
okay.
ones.
Okay. All right, so now I'm going to go closer to the suspect tooth. And, sorry, there's a globule there.
Mhm.
Okay, so I'm going to go to the 3 and see where we're at. 5, 6. And she's going to let me know when she starts to feel it. So what this is doing, We're up to 14, 15, nothing? No? 16, that's okay. This is a cuspid. Okay, so she's feeling it at a number 20. So what this is doing, this is just sort of activating the nerve for a response, okay? And everything that we're doing, we want to see the vitality of that pulp. So if that pulp was, if they had a pulpitis and that nerve was inflamed or bruised, you're going to be eliciting almost hyperactive responses, okay? Or if that nerve is dying, sometimes the response can be delayed, all right? And this is what we have to, for the doctor to have to decide. Is it a reversible pulpitis or an irreversible pulpitis? Have you covered this in your endo yet? Okay.
A little.
Not,
No, not.
We haven't started
no,
endo
haven't
yet.
started endo. Okay. So the terms will come. As you learn about them, the terms will make a little bit more sense. So now I'm going to go to, I'm going to change it to mid, off. Did you reset it every time you did it? No? Okay. Okay, I'm going to go mid because I'm going to do a premolar, and I'm going to put it on the 5. I'm going to put it on that suspect tooth, and I'm going to put it right on the buccal again. And this might take a little bit, just because we are on a cuspid, and there's a little bit more enamel. If the tooth was dying, like if that nerve was dying, sometimes we get no response because the nerve is dead. If it's a pulpitis where the nerve is still inflamed, sometimes they might feel it right away, and it could create a toothache, right? So then we know that tooth is probably going to need a root canal, all right? So now we're up to 30, and she's not feeling anything yet. Nothing? Okay. It's okay, we'll just give it a little bit more reading. Okay, now we're into 40. And you're not feeling anything there. No? Okay. I don't want to go any higher. Okay, so she had no response. So
Those ones top out at 42.
they do, okay. Yeah, so these little devices, they top off at 40. They won't go any higher, even on a high setting. They didn't go any past 40. So with the pulp testing that we've done, I would indicate, if I was a doctor, the dentist would indicate that this tooth probably needs a root canal. If the tooth was not responsive to the EPT, to the electric pulp tester, it would show that nerve is dying or has died, okay? It's tender to percussion, it's tender to palpation, and she's getting that cold sensation. So there's temperature that's going on it, so that nerve is probably mostly dead, okay, which is going to require a root canal. Now with Nina's tooth here, she doesn't have any restorations on her tooth. Sometimes you can have old restorations that are leaking, there's decay underneath, which could elicit it needing a root canal because that decay could go into the nerve. But here we have a tooth that had no work on it, and sometimes through trauma, maybe she bit on something, maybe she was grinding her teeth. She's a grinder. She expressed she's a grinder. So, she may have gone through a time where she's grinding her teeth, and then the nerve just couldn't recover from the grinding and the clenching, and the nerve dies, okay? So we would take a PA of this area. I would report the findings to my doctor and basically say, Nina came in, I did a percussion test, the 4-5 was responsive, palpation was responsive, buccal of the 4-5, 4-6. The EPT was inconclusive on the 4-5, but it tested positive on the anterior teeth in front of it. So they would have that information to come in and actually verify those tests, all right?
If the patient has, let's say they have a porcelain filling, would they still feel that kind
Yes.
of sense? Okay.
Yeah, it's the gold ones.
The gold ones, the metal
Yeah,
ones especially.
Yeah, the gold ones, it can throw off your readings a little bit, okay?
Sometimes they're just blended in so nicely.
I
that
know,
guess that
porcelain,
makes sense, right?
yeah, porcelain's fine, because it's just a different material, okay? So from there, then the doctor would make a prescription, do we need to do a root canal? In some cases, we might wait and see. We might do antibiotics, wait till things settle down, do a root canal, Or sometimes we say, like, how bad is it? Do you want to kind of do a wait and see? You know, because they don't, well, I don't want a root canal. Okay, do you want to wait and see for a few weeks? Sure, let's wait and see. Let's see if it recovers. If it recovers, then that was a reversible pulpitis. If it doesn't recover and the pain it lasts, then that's an irreversible pulpitis. Okay? So what we have here is, I was just going to show them the sheet now. Was there anything else you guys covered this morning?
No, I
Okay,
think that's it.
okay. So I'm going to show you the sheet that you're going to use for recording this. Okay, so you're going to have this in your blue book, and this is the experience sheet that Kathy was talking about. All right, so you're going to have the date, your patient's name, the non-suspect tooth number. So what I did was the non-suspect tooth, I went up to the, actually I went over across the arch. So I started off with the 3-4, 3-6 as a non-sus, like that's your control, okay? And so the electrical responses I actually did in the teeth in the same quadrant, right? So I did the 4-2, and I would mark off the electrical response. The thermal response is going to be the cold, and the thermal response was quite active on the 4-5. So you'll see here R is responsive, NR is non-responsive, okay? So sometimes what we do is we mark the tooth down. Non-response, non-suspect tooth would be the 4-2, and it was responsive within normal limits, WNL, okay? And then we have our suspect tooth number. So our suspect tooth was the 4-5. The electrical response, there was no response, all right? So it maxed out at 40. The thermal response was responsive, and sometimes when I do responsive, I'll do like a plus, because that was quite responsive. And I might even put down here pain lingered, okay? So this is how you're going to get your experiences for the pulp vitality, and you're going to need 5 of them, all right? So in your rotations moving forward, make sure you work on different people and have a control tooth and ask questions, okay? Really get into that conversation. You know, when does it bother you? Have you had to take pain medication? And did you take pain medication before you came? Yes, I popped 2 Tylenol before my appointment. We're going to have to dismiss them and get them back. Yeah, for we can get a more accurate reading. Wait till the Tylenol or Advil wears off.
If they've been sick with the sinuses.
Yeah. So maxillary teeth, Nina made a good point. For the maxillary teeth, if you have generalized pain, you can't pinpoint it to a tooth. How have your sinuses been? Have you had a sinus infection? Have you had a cold? So there's a few things that can play into having, that can have sensitive teeth, toothaches. Okay?
Is this the sort of things that you'd be doing when somebody comes in for like an emergency pain appointment?
Yep. Yep. So I see them, I mean, every day we have what we call specs, right? Special check appointments. So they come in, what can I do for you today? Oh, you know what? This upper left has been killing me. What's going on? It hurts when I bite. It woke me up at night. I've had to take Tylenol. And then first thing I do, and I look at them, do they have any swelling, right? So you're listening to their language. You're looking at them. Do they not look well, right? And I mean, you really have to take that information and relay that to your doctor. Really, you're not diagnosing, your doctor is, but you're just gathering that information. So when the doctor comes in, what they do is they narrow down, right? They solidify what you've done. Okay, it's kind of fun. It is, it's fact finding. You're hunting. You're
observing.
You're observing, and when you're talking to people, and like I said, the first thing I do is I look for things that are obvious. I say, have you broken a tooth? Have you been doing, aggressive chewing? Are you a gum chewer? I look for broken teeth. I look for fistulas. I look for things that are obvious to me. If I can't find anything that's obvious, then I'm going to go in and do the palpation, percussion. I'm going to do the thermal and the EPT if necessary. Okay? So once again, it's just gathering that information, talking to your patient, and relaying that information to your doctor. And then when you have that information, when the doctor comes in, I'm sitting at the computer, and I'm actually going through what I went through with the patient. Okay? And we're making things very specific. So for Nina's case, that's exactly how I would have written it down. Tested the 3rd quadrant, everything was within normal limits. Fourth quadrant, you know, tender to palpation, 4-5. Tender to percussion, 4-5. EPT was non-responsive, okay? Because if we do send that patient away with a prescription, and, you know, we put in like a treatment proposal just to say that, you know, this tooth may need a root canal, they may phone a month later and go, that tooth is killing me again. So what our receptionist is gonna do is they're gonna bring this up, and they're gonna go, oh yes, you know what, I see that you had some problems with this, let's book you in for that root canal, because that's what was proposed a month ago. So this information is imperative with your charting, okay? Any questions? So when you're doing your interview with your patient, as a patient, just kind of make up a tooth. You know, yes, okay, you know what, this 4-6 has actually been kind of bugging me, and you know, so to really get into that role playing. Make your operator ask the questions, and just to get these responses.
If you have teeth that are super sensitive right now, point that out to your operator so that they don't put colds and everything else on it. That's a good one to avoid.
Yes, thank you. Good.
Thank you
Why?
for
It was
being
my
our
bottom teeth that hurt.
Cut.
yeah. Thanks for being our patient, Nina.